And we are on the Health Watch this morning. Joining us this morning is Dr. Syed Hussain of Trinity Health of New England to talk about all those big headlines in the health world. Doctor, thank you so much for being here this morning. Appreciate it.
Thank you.
So one headline we've reported on so much over the past few months is this triple threat of respiratory illnesses. There is some good news on that front this morning. Let's take it one at a time here.
Sure.
COVID, RSV, and the flu.
Absolutely. Good news indeed. So we've seen a drop in all three respiratory viruses, Angela, across the country, but also indeed in the state of Connecticut as well. And that has manifested itself by not only cases that are decreasing for RSV, influenza, and COVID-19, but also hospitalizations, which is great because it takes a little bit a burden off of our healthcare systems. But nonetheless, we were always prepared for an eventual surge, but it's good news. Whether this will be sustained, the coming weeks will tell, because we're still not out of the cold winter season yet, but it is promising news nonetheless.
And what's interesting about this is the season started very early. That took a lot of us by surprise. What do you expect maybe in future winters? Is that going to be the norm, or was this kind of an anomaly?
Yeah, it's hard to predict. It was an anomaly this year, and what we usually see is whatever happens in the southern hemisphere helps us make a determination of how well or early prepared we need to be in terms of higher number of cases. So we saw what happened in Australia and New Zealand, for instance, last year, and that helped guide us in terms of our preparation.
And speaking of COVID, we have some big news from the FDA. They want to propose this new schedule for boosters that looks a lot like how we do our flu shots. Talk about that.
Yeah, so there's a scientific meeting that starts tomorrow where the FDA will present a proposal wherein the COVID-19 vaccine will become an annual vaccine. They seek to retire the earlier 2 shots of COVID-19 vaccine and just keep one vaccine that's going to be reformulated in June based on what the most predominant circulating variants are. And so that's the proposal. We'll see how that goes, and I'm sure there's going to be a robust debate both for and against it, so we'll see how that pans out.
And also on this vaccine front, some news about the HIV vaccine, late-stage trials failing. Tell us about that.
Yeah, it is disappointing nonetheless. But, you know, it doesn't mean it's the end of efforts to find an HIV vaccine. It's been very challenging over the last 4 decades since HIV popped up on the horizon. But the trial looked at 3,900 men, and while the vaccine candidate was safe, it was not effective in terms of neutralizing antibodies that would prevent HIV infection. So it's back to the drawing board. It probably sets us back by 3 to 5 years. But it also, you know, this has been a challenging area in terms of finding a credible, safe, and effective vaccine for HIV.
And what does that work look like from the ground up in terms of trying to find a vaccine for this?
Yeah, first it goes back to the drawing board in terms of finding a mechanism that would help elicit those neutralizing antibodies, and then, you know, goes through various stages. We saw this with the COVID-19 vaccine development. It was sped up because of the support of Operation Warp Speed, which you know, gave a lot of funding towards development of vaccine. And plus, we had 2 decades of data and evidence for the messenger RNA technology. So that enabled COVID-19 vaccines to be developed in a much shorter time frame. We don't see the same benefit with an HIV vaccine candidate.
And lastly here, we have some news about gonorrhea. I have this interesting headline that I want to read from the Mirror. Super gonorrhea, they put that in quotes, warning as people urge to reduce number of sexual partners. Super gonorrhea sounds super scary. Tell us about what that's all about.
Yeah, this is very concerning. This is a multi-drug resistant bug, gonorrhea strain that has been detected in other countries. It's the first time. We've seen 2 cases now in Massachusetts here in the U.S. It is concerning because it means that we have very few things left in our arsenal to combat this particular strain of gonorrhea. It means that we need to continue our research and finding other medications, but also ensure that we follow those public health measures that are important in keeping everyone safe.
And you mentioned cases discovered in Massachusetts, so close to Connecticut. Can we expect to see cases here anytime soon?
I don't think there's any reason to panic, but again, you know, it's important that we follow public health guidance in terms of testing, preventing STDs, and all of that. But it also puts the onus on public health officials that we need to find more, credible alternatives in terms of medications, antibiotics to fight such multi-drug resistant strains. I do believe this is going to be the norm, where we see more and more bugs pop up that are drug resistant.
We'll have to see. Doctor, thank you so much for joining us. Really appreciate your time, all the insight on these topics. Guys, I will send it back to you.